The current debate regarding the healthcare reform of the Obama administration and the kind of news that comes out about what's going on in the Supreme Court, and as well the various arguments that columnists like Professor Krugman gave out today in the New York Times, this being Friday, March 30th, can serve as a vehicle for stepping back from the arguments themselves and asking a couple fundamental questions. Sometimes we can think because the result that we believe to be right doesn't happen, that there's something wrong in the social political organism in which we all take part. That's not necessarily true if we look at history. Sometimes things didn't happen in a good way at a certain time because the situation wasn't right. There's a lot more at play than just the arguments of various kinds of individuals about what is right or wrong in this particular situation regarding healthcare. In order to appreciate the differences, it's important to recall something that goes with any kind of examination of the phenomenon of a living organism, and certainly the social life of a nation state like the United States of America is a living organism because all its parts are living. It's made up of people. So the question can be asked, which is an important question in biology, what's the nature of the context? Now in biology in general we talk about ecology and we talk about organisms, parts of the ecology occupying certain niches and various kinds of things like that. And we have yet to establish in our dialogues of social science a kind of organic social science. This very much is something that we need to have. We need to have an organic social science. So the remarks I'm making today are kind of a push in that direction, while recognizing that we're quite a ways from getting at it. But one of the things that we can do if we step back and examine the context of this situation that's going on now with the Supreme Court and what's called Obamacare, the context is, among other things, that in the United States of America we're probably the only huge economic Western democracy which does not provide free health care. Everywhere else there's been the sanity of providing free health care. What's the consequence of this? Well, the consequence of this is that what remains to be a kind of delicate situation between myself as a patient and my doctor, who is supposed to be my healer, is interfered with by large structures of bureaucracy. And if you recognize that a little bit of that is necessary, and then look at the numbers, it's very clear that the most efficient delivery system of healthcare services in the United States is Medicare. It costs the least amount because no private companies are overrunning the situation and taking their profits from the fact that people suffer from disease. Now that's part of the context. My view is that what the social body is saying in a kind of instinctive way, if it doesn't accept the Obama administration's solution to the healthcare crisis is that the direction that's being gone in is fundamentally the wrong direction. Now you can argue the tiny details of this particular problem as appearing in the arguments on the Supreme Court and in the articles of people discussing these arguments. But I'm saying step back and look at the context, and the context is that what happens if we continue in this direction, if, for example, we approve what's being called Obamacare, we remain tied to a private insurance industry which is far less efficient in delivering health care to the individuals needing health care. They are motivated because of the dynamics of their private corporation to maintain costs, for example, by erecting all these problems or issues like pre-existing conditions and the rest of it, any kind of way to deny insurance coverage. That's not going to be gotten rid of until, as a culture and a society, America decides to have free health care. So the fact that there's been this kind of, shall we say, weird set of arguments that comes from the fact that the Obama administration wants to propose that we be forced to buy insurance basically means that we're further entrenching and further rigidifying and further fixing into the structure of our society a system we already admit, if it was put to the vote of most of the people, we already admit we don't want. If we got the representatives who don't, that we elect to Congress out of the business of being members of their parties and out of the business of just representing huge financial corporations, and if it was actually put to a popular vote whether or not we had single-payer free health care insurance of some kind or another. And of course, what does it mean, single-payer? It means, well, you just, you pay taxes and you get insurance. That's it. It comes out of your tax payment. There's no third party like a private corporation or huge pharmaceutical companies that get to get their pound of flesh out of the fact that we get sick. And I think people instinctively understand that there's a fundamental unfairness and wrongness in this. And I, for one, think it's probably going to be a good thing if the United States Supreme Court says no.